35% of people have skipped a scheduled cancer screening during the pandemic. That's according to the Prevent Cancer Foundation. An Austin oncologist thinks it's much worse.
He's starting to treat more patients now with advanced stages of cancer that could have been detected earlier. Arceli Hernandez has his warning.
If someone were to miss a cancer screening, can the cancer rapidly grow enough so that when they finally get around to it a month or two later, that it's in a later stage?
Yes, excellent question. So we have seen, for example, in our breast cancer patients, the majority of our patients detected in early stages, they are detected by mammograms. The patients do not actually feel the lumps.
Dr. Miguel Albino says cancer screenings like a mammogram or a colonoscopy, yearly tests to check for cancer in people without symptoms, can save lives.
As an example, breast cancer, when caught at a very early stage, can be cured at a rate of over 90%, even as high as 98%. However, once we get into the more advanced stages, stage 4, for example, the cure rate is going to be very low, even less than 20%. So that is the danger of not scheduling and going through with our cancer screenings, is that we will miss something. And a lot of times, unfortunately, we do not have specific symptoms.
And the National Cancer Institute warns the drop in screenings for breast cancer and colorectal cancer alone may lead to as many as 10,000 additional deaths in the next decade.
Is that your biggest fear?
Yes, that is my biggest concern. Absolutely, is that I'm going to have more patients coming to me at a later stage in which I may not be able to help them to the effect that I would if we would catch them at an earlier stage.
Dr. Albino says at the beginning of the pandemic, he was seeing a 90% reduction. Now he's seeing 1/3 of people getting screened for cancer.